Hey, my name is Molly, and I will be sitting in for Karen Anderson this week for our week in review. This is Medical Monday, and we have our medical student, Samantha Colon or Cologne, I'm not sure. Colon? I will ask her. And she has given us some really great information on medication. So this week, we're continuing our medication spotlight with angiotensin converting enzyme inhibitors, also known as ACE inhibitors. And what are they? Well, they are a class of drugs commonly prescribed to manage high blood pressure or hypertension and heart conditions. In patients with aortic disease controlling blood pressure, actually, in patients with aortic disease, controlling blood pressure is critical to preventing further damage to the aorta. High blood pressure increases the force exerted on the walls of the aorta, which significantly raises the risk of rupture. By lowering pressure, ACE inhibitors help to stabilize and minimize the strain on the aorta, which is what our goal is. And how do they work? They work by blocking the enzyme that converts angiotensin 1 to angiotensin 2. It's a substance in the body that causes blood vessels to narrow. When angiotensin 2 is reduced, blood vessels relax and widen, allowing blood to flow more easily. This leads to a decrease in blood pressure, which reduces the amount of force the heart needs to pump blood through the aorta. So that's a goal that we all need here. Here's a beautiful diagram of a thin, healthy blood vessel. Anyway, check that out. That's pretty cool. I like understanding how our medicines work. And there's a link for you to click on to further investigate. So, for patients with aortic disease, lowering blood pressure with ACE inhibitors is vital because it helps slow down the progression of aneurysms and reduces the risk of dissection. Also, ACE inhibitors improve heart function. This is helpful in patients whose aortic disease is accompanied by heart failure or other cardiovascular issues. Some common ACE inhibitors for managing aortic disease include lisinopril, enalapril, and ramipril. I think the most common there is lisinopril. That seems to be the common entry-level blood pressure medication that I've, heard of. Studies suggest that ACE inhibitors can reduce inflammation and improve the structure of blood vessels over time, which may help prevent the development or progression of aneurysms. For patients with conditions like bicuspid aortic valve disease, ACE inhibitors are used to prevent excessive aortic dilation. Just like beta blockers, which she had covered in the first medication spotlight post in the weeks prior, ACE inhibitors are often a long-term treatment for patients with aortic disease. Regular monitoring by healthcare providers is important to ensure that the medication is effectively controlling blood pressure and preventing complications. Patients on ACE inhibitors may also undergo routine blood tests to check kidney function and electrolyte levels, as these medications can affect both. If you or a loved one has been prescribed ACE inhibitors for aortic disease, it's crucial to take them as prescribed and work closely with your healthcare team to monitor your condition. And always consult with your doctor to understand the best treatment strategy for your unique situation. Thank you for joining us this week, Aortic Hope family. Stay tuned for our next medication spotlight post in 2 weeks. Always a pleasure. Samantha, think aorta.